Welcome to the Victory Education Lounge. I'm your host, and today we're exploring a critical topic that affects millions: vision loss and insulin resistance. This is part 101 of our ongoing series on metabolic health. Before we dive in, please take a moment to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Your engagement helps us reach more people with this vital information. Many people don't realize the significant connection between insulin resistance and vision loss. Whether you're concerned about your eyesight, managing insulin resistance, or simply aiming to optimize your overall health, understanding this link is crucial. Today, we'll explore how insulin resistance affects your visual health and discuss solutions, management strategies, and prevention methods. Have you ever wondered if there could be a link between your vision problems and insulin resistance? Well, it might surprise you to learn that these two health issues can indeed be interconnected. Insulin resistance, a condition where your body doesn't respond effectively to insulin, is quite prevalent. It's a silent issue that affects millions of people worldwide, often leading to high blood sugar levels and a host of potential complications. One area that can be significantly impacted is your vision. From blurred sight to more serious conditions such as retinopathy and macular degeneration, insulin resistance can take a toll on your eye health. But don't worry, knowledge is power. By understanding this link, we can take proactive steps towards better eye health and overall well-being. So let's delve into this fascinating topic and uncover the truth behind insulin resistance and vision problems. Stay tuned as we explore 6 vision problems associated with insulin resistance. First on our list is diabetic retinopathy. This condition is a diabetes complication that affects the eyes, specifically the blood vessels of the light-sensitive tissue at the back of the eye, the retina. It's the most common cause of vision loss among people with diabetes and the leading cause of vision impairment and blindness in working-age adults. Now, how does insulin resistance come into play? Well, when your body's cells don't respond effectively to insulin, it results in high blood sugar levels. Over time, these high sugar levels can cause damage to the tiny blood vessels in your retina, leading to diabetic retinopathy. So, how can we manage this condition? The first strategy is to maintain tight control over your blood sugar levels. Regular monitoring and adjustments to your diet or medication can help keep your levels within a healthy range. Secondly, regular eye exams are crucial. These exams can catch any issues early on, allowing for prompt treatment to prevent further damage. Let's consider an example. Meet Sarah. She's 55 and was diagnosed with prediabetes. She focused relentlessly on controlling her blood sugar levels. After a year of maintaining normal levels, her eye exam showed no progression of early retinopathy. This goes to show the power of proactive management in preserving our vision. Remember, early intervention is key in managing diabetic retinopathy. Next up, we have cataracts. Cataracts are a condition where the lens of your eye, which is normally clear, becomes clouded. This clouding can impair your vision, much like trying to peer through a fogged-up window. Now you might be wondering, what's the relationship between insulin resistance and cataracts? Well, insulin resistance can cause excessive sugar in your lens, leading to swelling and eventually cataracts. So, how can we manage this? The first strategy is to maintain a diet rich in antioxidants. Foods like berries, nuts, and dark chocolate are excellent choices. Next, protect your eyes from harmful UV rays by wearing sunglasses outdoors. Lastly, managing your blood sugar levels is crucial. Remember, consistent high blood sugar can accelerate the development of cataracts. Take John, for instance. He is 62 and managed to slow down his cataract progression significantly over 2 years by increasing his intake of antioxidant-rich foods and wearing UV-blocking sunglasses regularly. Managing your blood sugar levels and protecting your eyes from UV rays can help delay the onset of cataracts. Moving on, we have glaucoma. Glaucoma is a group of eye conditions that damage the optic nerve, which is crucial for good vision. This damage is often caused by an abnormally high pressure in your eye, and unfortunately, it can lead to irreversible blindness if not treated promptly. Now, how does insulin resistance tie into this? Well, research suggests that there might be a link. Insulin resistance can lead to changes in blood flow to the optic nerve, increasing intraocular pressure and therefore the risk of glaucoma. So what can we do to manage this potential risk? Regular eye pressure checks are crucial. These can be done as part of your regular eye exams or separately if you're at an increased risk. Exercise is another key strategy. Physical activity can improve blood flow to the optic nerve and help reduce intraocular pressure. So, whether it's a brisk walk or a yoga session, get moving. Stress reduction techniques can also play a part. Activities such as meditation or deep breathing exercises can help lower your overall stress levels, which can be beneficial for maintaining healthy eye pressure. Let's take an example. Consider Lisa, who is 58 years old. She incorporated daily walks and meditation into her routine. Over 6 months, her intraocular pressure stabilized, reducing her risk of developing glaucoma. Regular eye pressure checks and lifestyle modifications can help maintain healthy eye pressure. Let's turn our attention to dry eye syndrome. This condition is characterized by a persistent dryness of the eyes, often accompanied by a stinging or burning sensation. It may not sound like a big deal, but for those affected, it can significantly impact their quality of life. Now, how does insulin resistance fit into the picture? Research indicates that insulin resistance can affect the production and quality of tears, leading to dry eyes. In fact, individuals with insulin resistance often experience more severe symptoms of dry eye syndrome, making it a vital concern for those managing their blood sugar levels. So, what can we do about it? The first step in managing dry eye syndrome related to insulin resistance is focusing on overall metabolic health. This includes strategies like maintaining a balanced diet and engaging in regular physical activity, but there's more. Omega-3 supplementation has been shown to have a positive effect on tear production and quality. Ensuring proper hydration also plays a significant role, helping to keep your eyes lubricated. Additionally, using a humidifier in dry environments can help mitigate symptoms. Let's consider an example. Meet Mike, a 50-year-old who was struggling with dry eye symptoms. He started taking omega-3 supplements and made a conscious effort to increase his water intake. Within 2 months, he experienced a 40% reduction in his dry eye symptoms. Remember, proper hydration and omega-3 supplementation can improve eye comfort and protect the eye surface. Next, we're discussing macular degeneration. This condition affects the macula, the part of your eye that's responsible for central high-resolution vision. Macular degeneration primarily impacts this sharp, straight-ahead vision, which is crucial for activities like reading, driving, and recognizing faces. Now let's delve into the connection between this condition and insulin resistance. Studies suggest that insulin resistance may accelerate age-related macular degeneration. Essentially, when your body's cells become less responsive to insulin, your blood sugar levels rise. This increase can lead to damage in the blood vessels, including those in the macula. Consequently, this damage can speed up the degeneration process. So, what can we do to manage this? First and foremost, adopting a diet rich in lutein and zeaxanthin, nutrients found in leafy greens, is beneficial. These nutrients are known to help protect the macula. Additionally, quitting smoking is a crucial step, as smoking can further damage the blood vessels in the eyes. Lastly, controlling your blood pressure can also help to maintain the health of your eye's blood vessels. Let's take a look at an example. Meet Emma, a 65-year-old who was diagnosed with early-stage macular degeneration. Emma decided to make some changes. She adopted a diet rich in leafy greens, quit smoking, and worked to control her blood pressure. Over the next 3 years, her macular degeneration remained stable, a significant contrast to her earlier progression. Dietary and lifestyle changes can slow the progression of macular degeneration. Finally, let's discuss diabetic macular edema. This condition is a complication of diabetes that occurs when fluid accumulates in the macula, which is part of the retina that controls our most detailed vision abilities. Due to this fluid buildup, the macula swells and thickens, distorting vision in a significant way. Insulin resistance can be a primary driver of this condition. You see, when your body isn't responding effectively to insulin, your blood sugar levels can rise. Over time, these high blood sugar levels can cause damage to the blood vessels in your eyes, leading to fluid leakage and swelling in the macula. Managing diabetic macular edema involves a multifaceted approach. First, and perhaps most crucially, is maintaining tight control of your blood sugar levels. This can often be achieved through a combination of diet, exercise, and possibly medication. Regular eye exams are also key to managing this condition. These exams can help detect any changes in your vision or the health of your eyes early on, allowing for prompt intervention. In some cases, laser treatments or injections of medicine into the eye may be needed to slow the progression of the disease and prevent further vision loss. To illustrate, let's consider the case of Robert. Robert is a 60-year-old man who was diagnosed with type 2 diabetes and insulin resistance. He noticed that his vision was beginning to blur, so he visited his eye doctor, who diagnosed him with diabetic macular edema. Robert took action by adjusting his diet and exercise routine, effectively controlling his blood sugar levels. He also began regular eye exams and received treatment when necessary. After 2 years, his condition stabilized and his vision remained unchanged. In conclusion, understanding the link between insulin resistance and vision problems can help you take steps to protect your visual health. It's important to remember that early detection and management are key in preventing and slowing down the progression of these conditions. So, stay vigilant, stay informed, and remember, your vision is worth fighting for. As we've seen, insulin resistance can have significant effects on your vision. From diabetic retinopathy to macular degeneration, the implications are far-reaching. But remember, knowledge is power. Understanding this connection allows us to take proactive steps in managing and maintaining our visual health. Let's continue to learn, grow, and share this crucial information with others. After all, vision is a precious gift, and preserving it requires our attention. Your eye health is important. Don't overlook the impact of insulin resistance on your vision. Remember, managing vision health in the context of insulin resistance requires a comprehensive approach. By addressing your metabolic health, you're not just protecting your eyesight, you're supporting your overall well-being. Thank you for joining us in the Victory Education Lounge. Don't forget to like, subscribe, and share your thoughts in the comments. Your experiences could help others on their journey to better health. Disclaimer: the information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice. Any health-related decisions, especially those related to eye health and insulin resistance, should be discussed with a licensed physician or qualified healthcare professional.